Hi, everyone. My name is Hannah Hoke, and I am the program director of the athletic training program at the University of Kentucky. And I am here to talk to you about the adult knee patient case. So this case was designed to provide a simulated patient case with an adult patient that participates in a non-sport activity. In my opinion, this case can be used to address many of the curricular content standards for both early and advanced learners. So I'm going to kind of walk you through what I was thinking as it pertains to the standards, but then also how you can address early and advanced learners within the case itself. So as written, this case minimally addresses the history taking portion of Standard 71. In addition, this case can also address written and oral communication with the patient, which are elements of Standard 59. You could choose to advance the standard by asking the learner to write a note for referral to the appropriate interprofessional colleague, or even include an additional second experience where the student would call a mock interprofessional colleague and discuss the patient case itself, where you would then evaluate their interprofessional communication in that second opportunity. You could also enhance this case to address Standard 57. Perhaps advanced learners could develop patient education and information that accounts for the patient's health literacy and other social determinants of health. We have included some different information in the social history element for advanced learners and early learners, but you could definitely enhance that should you choose. Additionally, I believe that Standard 58 may be able to be applied if the learning objectives include patient education regarding self-care for the current condition. Again, that would need to be a learning objective that you add and another evaluation of that material that they create. If you'd like to modify the case, you may also choose to include elements of Standard 79, and that the students could develop and implement strategies to mitigate risk of the long-term health conditions such as osteoarthritis, if you choose to address that standard as well. So I feel like the template is there, and you could add some information and address the learning objectives to hit that too. But lastly, I think this case lends itself to be viewed from the lens of the ICF model or Standard 60. I've specifically tried to include limitations, impairments, and restrictions, but also contextual factors that could be identified. So I believe that this case could really lend itself to being utilized as an exercise in the ICF model application, and potentially even discussing barriers and facilitators across those personal and environmental factors, and maybe more in-depth conversation on how those factors may be influencing those domains of function in this patient themselves. If you take a look at the patient case, I've identified some of this for advanced learners and early learners within some of the specific boxes, but overall, I feel like, feel free to utilize this as a template to make it what your program needs as it aligns with all these different standards. Thank you so much for your time, and I would really appreciate any feedback that you have. So if you do utilize this in your program, if you want to send me an email about the experience and provide feedback, that would be great. You can email me at Johanna, JOHANNA.Hoke, HOCH @uky.edu. Thank you.